Hey, so I chose to report about narrative therapy. So narrative therapy is exactly what it sounds like. It's a story, just like you heard about in your high school English class. So the founders of narrative therapy were David Epstein, he was the developer who worked with people that had eating disorders, and Michael White, he was the co-founder that worked with families and communities. So here's the gist about narrative therapy. Everybody's got a story. Some are problem saturated. So when a client goes to a narrative therapist, he or she is going to help the client take those problem-saturated stories and turn them into new stories. So the narrative therapist separates the person and the problem, and new stories and futures are created without the problem. So the client is the expert of his or her own life, and the counselor and the client have a very collaborative relationship as new stories are created. Narrative therapy can be viewed in 4 phases. Phase 1 is the joining phase, and it occurs when the therapist meets the client and they begin to build a relationship, and the client shares his or her problem-saturated story. So phase 2 is called examining patterns, when the client is invited to examine stories that contradict, deny, or oppose the problem-saturated story. Phase 3 is reauthoring, when the client begins to build new, more positive stories. And phase 4 is moving on, when the client has developed a new, more positive outlook on life and is ready to leave therapy. The focus of narrative therapy is a very collaborative approach between a counselor and a client, where the counselor listens very respectfully to the client's story. The counselor listens for times in the client's life when he or she was very resourceful. There's a lot of questioning as a way to engage and facilitate exploration. The counselor avoids diagnosing or labeling the client. The counselor assists the client with mapping out the problem and how it has influenced his or her life. And again, the counselor assists the client in separating him or herself from the problem. The function of the therapist is to act as a facilitator, help the client construct a preferred storyline, explore and reduce the impact of the problem, ask questions, and assume that the client is the expert of his or her own life. Again, the therapeutic relationship is very collaborative rather than problem-based. It is strength-based and future-focused, and the therapist, as the expert, is replaced with the client as the expert of his or her own life. Group counseling can also be instrumental with narrative therapy, since the group creates an appreciative audience for narrative therapy clients to discuss new developments in their lives, and this can be especially effective for school settings. Strengths from a diversity perspective and social constructionism is congruent with a philosophy of multiculturalism. A framework is provided for clients to think about and determine the impact stories have on what they do. To explore how their realities are being constructed out of culture discourse, and explore their beliefs to provide their own reinterpretations of significant life events. The weaknesses from diversity perspectives is that therapists are allowing the client as experts, which may seem as a lack of confidence. Therapists need to convey their expertise in processes of therapy and the client's expertise in knowing what he or she wants for his or her life. The major focus of narrative therapy is where people want to go rather than where they have been. One technique I really liked in narrative therapy is documenting the evidence. The narrative therapist writes letters to the client recapping their session and includes the problem, the effect it has on the client, and the client's strengths and abilities identified in the session. Sometimes direct quotes from the client during the session are included in those letters. The client can continuously be inspired by reading those letters, and the value of these letters has said to be worth more than 3 therapy sessions to a client. Thank you for listening, and I hope you learned something about narrative therapy.